So our topic is universal healthcare, and the people in our group are me, Andrew Werner, Hayden Horn, Mason Miller, and George Krieger. Okay, so here's some context. Today in America, healthcare is one of the most heavily discussed topics in media and in politics. The U.S. has a rather unique system for healthcare for its citizens. The best way to describe the system would be to say it's a hybrid system. Healthcare providers are largely privately owned businesses in the U.S. According to the World Health Organization, 58% of U.S. community hospitals are nonprofit, 21% are government-owned, and 21% are for-profit. Since healthcare providers are mainly privately owned businesses, that means that they are trying to get a profit from their buyers. But the price of healthcare in the U.S. is incredibly high, and many lower-class citizens cannot afford healthcare. This is why so many people desire a universal healthcare system in America. So as you can see from this chart, the United States pays one of the highest rates for spending per person on healthcare. Alright, our problem is that universal healthcare requires too much money and resources for both taxpayers and the government. So what this means is that this is contrary to popular belief to some people. Many people believe that universal healthcare is less expensive than the U.S.'s current system. But the reason this is false because when you're paying for healthcare, you're paying for quality. Another reason is that when privately owned businesses provide healthcare, they have such high prices because they can provide it in a standard far nicer than government healthcare providers would be able to produce. In order for a system of universal healthcare to be able to keep up with the quality of healthcare that a privately owned business would provide, the cost of universal healthcare would go way up. If the price of universal healthcare were less expensive than the price of privately owned healthcare providers, then the quality of healthcare would decrease significantly. We can see this in places like Canada, where wait times for emergency rooms and clinics are very long.
So our first solution to the problem would be to redirect the money from income taxes to a new federal agency, and that agency's purpose would be to provide healthcare to Americans, and it wouldn't have any other job, which is like right now healthcare is being managed by the Department of Health and Human Services, so we would create a new department to manage that, so that's all they're focused on. And so one of the big pros about this is that the taxpayers won't have to pay any more money because we're just going to redirect the money that they already pay in income taxes. And another pro is that the agency has just one focus, so all it has to worry about is providing healthcare to people. So there's no other FDA, there's no branches of it. It's just one agency with one job. One of the cons of this is that the money, it has to be taken away from other areas, such as maybe roads or infrastructure. That way we can provide universal health care with no additional charge to people. So you are making a sacrifice in order to pay lower taxes for this. And then another con would be that only a specific amount of money could be used. Even if they need more to insure more people, that would be impossible because we're just redirecting the income tax money, and we want that to stay at the amount it is now and not go any higher. One of the limitations is that you can only put so much money in, so you can only get so much out of it. So most likely it wouldn't be as high quality as a private healthcare insurer. So people would have to decide if they still want to allow private companies in which Americans can still buy from, opposed to this system. And it's not a testable thing. There's no way to have a try and fail because you are using people's money from their income taxes. So it has to work right away. And the implications of this are that people would have access to health care for no additional charge, and that the death rates would be substantially lower. And then as you can see on this graph, this is healthcare spending over the years in the US. And so this is the income tax money. It's currently being used for the Universal Healthcare Program, the Affordable Care Act. And then right here, this is the private companies spending. And down here, these are what businesses are spending and what people are spending for for their health care.
Single-payer healthcare is where a public organization organizes healthcare financing, but healthcare is still provided by private companies. Canada is an example of a country who has single-payer healthcare. Single-payer healthcare systems are significantly less expensive than other forms of universal healthcare. Some of the reasons for this are that with single-payer healthcare, the cost of having several different organizations manage it isn't there. It also makes it so insurance companies can't really compete with each other, which can cause some of the prices of healthcare to lower. Some disadvantages can be that people have to wait a really long time to get medical services because there are less people that will want to work at work. It also causes the quality of medical care to go down because there is less motivation for people to work hard. Some of the limitations of the single-payer healthcare system is that it's hard for one organization to fund everyone's healthcare. Even though it is less expensive than other forms of universal healthcare, it is still hard for one organization to pay for it. If single-payer healthcare was implemented, everyone's quality of medical care would go down, and people would have to wait a long time to get medical services. It would be less expensive than other forms of universal healthcare. Canada is a great example of what would happen if single-payer healthcare was implemented.
So, in conclusion, many people would like to have healthcare, and it makes sense because there are 58 countries, not counting the US, that have universal healthcare. And the US is being one of the richest countries in the world, it seems like it should have it, but it doesn't. Our group came up with 2 solutions to this, and in the end we decided that the redirecting taxes would be the better solution, because this would be popular with the people because they wouldn't have to pay extra taxes, and also we wouldn't have to take away money from private businesses and get more loans. With this solution, we would finally join the many developed nations that have universal healthcare, and we would meet the needs of the many who cannot afford the high rates of health insurance that we have. This would provide a steady stream of money leading to a quality healthcare system unlike many other healthcare systems in other countries. Thank you.
Okay, guys, a couple of questions, and I'll just go straight across them. So, what would you say? That one way that improved your ability to work within a group as a result of the option you had to work with a team? What's one way you changed?
Well, so before this, I hadn't really used the lenses in other group projects. So since we got to each use our own lens, we each got a different perspective to look at things in our argument. And so we each had to talk about what we're going to say in this presentation. And it really just helped me to collaborate more with the other people so that we're making sure that each thing that we say makes sense and it all comes together more easily.
Let's see, Mason, when you guys looked, what was the strongest counter-argument that your team identified to your ultimate solution?
The best counter-argument was that it costed way too much money to really implement a good healthcare system. It wasn't like the money that we have to make a universal healthcare system would make one that is poor quality, and it wouldn't be worth the money that we put into it.
Hayden, reflecting on the other guys in your group's work, which one had the greatest impact in your overall understanding of the problem? Like, whose research would you say made you understand this better?
Probably Mason's, because it was from the ethical lens, which that really one of the main focuses of universal healthcare is everybody has access to healthcare, so they can live longer and be healthier. So I think the arguments for the ethics of it really were a big part of this, because that's one of the driving factors of it, and that's what a lot of people focus on for this topic.
And then finally, George, how how did the content of the team's overall presentation change as a result of group discussion? Give us a view in what that discussion was like that ultimately produced it.
Well, it started out as, I think we started with a lot of, I don't think we had as much of ethical and social and cultural stuff in our argument as when we started. It was mostly from an economic standpoint with like, there was less of Mason's argument in it, more of Hayden's when we started, and then through discussion we added more of the ethical lens